A broken bone is also known as a fracture. There's a common misconception that a broken bone is worse than a fracture. In reality, they're the same. The broken bone is the common term, the fracture is the clinical term. There are different types of fractures or breaks. A bone can be broken and the fragments can be out of position. We call this a displaced fracture. If a bone is broken and you can barely see it, it's a hairline fracture. If a bone is broken and the two ends are in good position, we call this a non-displaced fracture. Finally, if the bone is broken and one of the fragments have punctured through the skin, we call this an open or compound fracture. Broken bones are usually splinted initially to prevent bone movement and further damage to the soft tissues that surround the bone. If the fracture is displaced, it may need to be set. If the fracture is open or compound, it needs to go to the operating room as soon as possible to be cleaned out. Even though all this sounds very scary, most fractures can be managed in a cast without going to the operating room. At Stafford Orthopedics, fractures or broken bones, no matter how small, are considered urgent. If you, your loved one, or a friend have a broken bone, we will make every attempt to see you as soon as possible, usually the day you call.